Welcome back to Daniel Ultrasound Clinic. Here is Dr. Munir Abbasi. Here we have got this interesting topic. The patient with complaint of swelling in the left scrotal area sent by a physician. Now let us see what is going to be disclosed. On scanning of the left scrotal sac, we have got this nodular hypoechogenic structure in the scrotal sac, which is definitely left testicle. The interesting thing to note here is that around the testicle we have a hyperechogenic structure with poorly defined margins or boundaries, and it is showing no peristalsis at all, even on cuffing. I will show you later, but first I have to explain it. So around it there is a hyperechogenic structure which is showing no peristalsis, and coming from the upper part of the inguinal canal and traversing into the scrotal sac. On cuffing, let's see what comes out, what happens. Baba, thoda cuff kar zor sa. Here, you see something is moving in the inguinal canal, going downward and then backward, upward. Very cuff ke bota. Butter je karke. So, and this is showing no peristalsis at all. So this is omental hernia or fate, where there is no bowel loops inside it. And though it is not quite fully reducible, it's partially reducible and showing no incarceration or strangulation. However, it is omental hernia, maybe due to carrying weight or anything else like that. Now, the associated findings we have to see here are the fluid collections or in strangulation, but there is no such thing. Now, how to define this thing on ultrasound? We have to define, like on ultrasound, a defect is noted in the anterior abdominal wall at the umbilical region through which hyperechoic omental fat is seen protruding, consistent with an omental hernia. No bowel loops or peristalsis are seen within the herniated sac, and no sign of incarceration or strangulation you see here. So this is definitely omental hernia which has taken place due to reason unknown, maybe due to carrying weight or constipation or chronic cough. So that's the end of our session. I wanted to show you this thing which is very interesting. Here is the omental tissue. Very cough ke baba? You see once again you see to and fro motion. Means it is traversing through the inguinal canal. So that's the end of our session. Thank you very much.